Hey everybody, welcome back. I'm Dr. Broughton and this is Dr. Dunn, and we thought we'd share today one of the most common procedures that we do in the dental practice, which are fillings.
It's a common questions that patients will ask is, what is a filling? And what I will say to patients is it's a repair or restoration for part of the tooth that has been damaged. And there are two main types of fillings that we end up placing. The first is a silver filling called amalgam. And they have been used for decades in dentistry with good success. And then the second type of filling that is commonly used is called composite, and patients really like it. They'll call it tooth-colored fillings because it looks like you haven't had anything done to your tooth after it was fixed. And those have gone sky high in popularity because of the aesthetic reasons. Dentists, we really like it because it has the adhesive property where it sticks to the tooth, and so it seals it really well.
Yeah, I have a number of patients who have asked about the Mercury in fillings and whether or not it's safe.
Yeah, it's a great question. We will have patients that come in and ask if they need to have their silver fillings replaced because of the mercury. And my response to this, as a biochem major, yes, mercury on its own can be dangerous, but when it is in the amalgam mixture and it is bonded to other metal ions, it is inert, it is safe. I will tell patients, and something that they can also understand is the molecule carbon. So carbon in its elemental form is carcinogenic, but it's also in everything we eat. It is bonded to oxygen ions, it is bonded to hydrogen atoms, and in that form it makes up everything that is organic, and so it is safe in that form. So just like that, mercury is also safe.
So another thing that patients ask, and I think it's probably the most common question, is why do I need a filling? And I think of it in three different reasons. One would be if you have a cavity, two would be a chip or a small fracture in a tooth, and thirdly would be a restoration that is failing. And Dr. Dunn, do you want to talk about the cavities?
Sure. Yeah, so the most common spot to get a cavity is on the grooves of your molars. They're deep, the food packs in there, and so it's an easy spot to get decay. And then the second most common spot to get a cavity and need a filling is for in between the teeth.
Like a flossing cavity.
Or a no flossing cavity, yes.
Yeah. And with chips and fractures, they always come at the most inopportune time. I think of a patient who calls and they chip their front tooth and then they call in a panic because they have a wedding or pictures that are coming up. And one of the great things about Light Dental Studios is that we do have multiple providers and we offer same-day dentistry. And our hours are from 7 in the morning till 7 at night on Saturdays, and so that makes it convenient so that if somebody has something like that happen, that we can fix it really quickly. With that, some patients will say, well, is there a way to extend the life of a filling? And I know an average filling will last about 7 to 10 years, but we have seen people who have fillings that have lasted much longer. So what are some of the things that we can do that
prolonged fillings? Yeah. There is our basics that you will hear every dentist preach until the end of time, and that's brushing and flossing. So brushing twice a day for 2 minutes, and flossing, of course, will reduce the risk of forming a cavity under a filling. But you also can think of things that will reduce the wear and tear on the fillings that you have, or your teeth. And so you don't want to use your teeth as tools, open things, or cut off fishing line, things like that. Or chew really hard things. You never want to chew on ice. You don't want to freeze a Snickers bar and chew on it, because that will just wear out your fillings and wear out your teeth.
So lastly, people or patients will often ask, what is it going to be like after I have my fillings done, and what's the procedure like? And It is a minor surgical procedure, and we do have to get you numb, so there's a little bit of healing time afterwards. And
yeah, we expect some tenderness wherever you got numb, and then the tooth going through that minor surgical procedure will have an inflammatory response. And we expect some sensitivity, maybe up to a couple of weeks. Some patients are sensitive for longer, some patients don't get sensitivity at all. But as long as we see it trending in a positive direction where every day it's a little bit better, we're okay with that. If a patient gets aching, throbbing, spontaneous pain, it wakes them up at night, then that would be something where after the fact we'd go, yeah, we do want to see you. We want to see if something has changed.
And if I have patients, sometimes they'll get a little bit of biting sensitivity. Mm-hmm. That's common after the procedure. It generally goes away within a couple of weeks. If it lingers longer than that, sometimes it's good to call back and check. Anyway, we hope that you found that helpful today. If you've got further questions, feel free to leave them in the comment section below and we will answer them. And until next time, lights out.